Are you aware that Medicare spends up to $7 billion on social isolation-related issue? Today, we will explore two innovative solutions within the healthcare space on how they are leverage social connection to improve patient outcome and business development. Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. I had the pleasure of interviewing many healthcare solutions at Vive 2024 in Las Vegas back in February. And today we had a fortunate to present you two of the solutions that are leveraging social connections. The first speaker is Catherine Steinbaum from Determined Health. They are truly trying to change the way that we relate to our patients and therefore changing their outcome by addressing the $3 billion issue of Medicare spending. And Determined Health is creating trust and engagement in activities that are leveraging social bonding. And listen up as how they are able to do so. Where I'm Vive today, so we are here with Catherine Steinberg of Determined Health. Thank you so much for joining us.
Thank you for inviting me. It's great to be here.
Yes, we always love events. It's great energy, great to meet a lot of amazing people like yourself. So tell us a little bit about your mission, about the company, how did it get formed, and how are you going to really push this thing forward?
Yeah, so at Determined Health, we're really on a mission to address social isolation and loneliness and other social drivers of health. And ultimately, we do that by focusing on creating meaningful connections. And we believe that meaningful connections lead to trust, and trust leads to engagement. And so our approach starts with a platform that facilitates individuals connecting in a safe and secure way so that health plans can refer members who are at risk of being socially isolated or lonely and connect them with people in the community for social calls. And it's through those social calls that we're able to better identify their needs and provide that information back to the care team at the health plan or the health system or the community organization that we're working with.
For sure, isolation is definitely a big issue when it comes to anybody, even quote-unquote healthy people. If you just move to a new place, and therefore, when we're thinking about our parents or anybody who's by themselves, it definitely can be at risk for so many things, and that we are not sure where they are. Even my mom, she lives across the country from me, right? And then she's still very vivid in her 60s and still working. But all of us wanted to have that safety ground. So I love that you guys are focusing on that side. What has been some of the bigger wins for your company so far?
Yeah, we've had a lot of really exciting partnerships that have been significant wins. We have a partnership with Meals on Wheels America and are working with a number of Meals on Wheels organizations across the country to help them identify and support people that are at risk of loneliness and social isolation, which we know increases morbidity and mortality, and ultimately increases Medicare costs up to $7 billion according to the AARP. So this is a really important issue for many organizations and individuals. As you talked about, your mom is out there, but as people age, their communities get smaller for a whole host of reasons, and the ability to connect with someone on a regular basis and create a trusted relationship is really key to them feeling connected, and even addressing not just social isolation and loneliness, but also demonstrated to reduce depression and anxiety significantly.
Which is amazing to be able to capture all that information together.
Yes.
And have you guys seen that when it comes to adaptability, when it comes to sharing this information, that has to stand out from the crowd in the sense of all this new technology coming out? So what has been a coming to the market strategy that you guys have been working on to make sure the right people are using these technology?
Yeah, so we are really about kind of right person, right time focus. Social connection and phone connections might not be the highest tech or sexiest thing at Vive today, but ultimately we meet people where they are. Older adults in particular are not necessarily comfortable with having apps on their phone or accessing different virtual technologies, but the ability to connect via a phone, any phone, no app or Wi-Fi required, is actually a mechanism to really meet people where they are, as you described, and better understand their needs and how to engage them in their health.
That's amazing. So has it been that you guys have been having specific strategy to outreach these individuals with organizations or communities?
So we work through other organizations that already have patients and members that they are looking to serve. So we serve health plans, primarily Medicaid right now, in several different states, and they provide us a list of their members who they think could benefit from greater social connection. We also work through organizations like Meals on Wheels America, and their organizations often use our SaaS platform to connect with the folks that they deliver meals to so that they can connect with them for more than just that moment of delivering the meals, but also connect with them outside. Similarly, we have health systems that work with us. We're working with one fabulous health system, Metro Health in Cleveland, and they have a program called Calls for Hope, and they use our platform to facilitate volunteers from within their health system connecting with their patients on a regular basis. So we're not directly identifying the end user, if you will, but it's the organizations that we support that are helping their customers, whether they be patients or members or clients, connect with people in their community and reduce their feelings of loneliness overall. And if we're successful, also helping them in other ways, whether it be identifying transportation issues, finding out that they're food insecure, finding out that they recently fell or they're having trouble seeing. All these things are very impactful on the likeliness of that individual ending up in the ED. And if we can identify these things early, we can connect them with the resources to avoid that.
Right. It's also helping not only the quality care of these individuals, but also reduce the hospital and the societal costs on the healthcare burden.
Absolutely.
Now, if you have a magic wand,
yes,
something would just instantly disappear out of the challenges of how you think this can really push through, what would that be?
Yeah, what a great question. If I had a magic wand, I mean, for me, it's getting this into the hands of organizations across the country. We are a small, early stage company, and we've had incredible success in building our customer base in just our first 2 years as an organization. But I want to, spread the ability for organizations across the country to connect. I guess my vision is that this allows for almost a sea change of people that can take 15 minutes out of their day each week to connect with someone in their community. And if we can find a way to spread that more rapidly, I think we can make a really big impact on loneliness in this country, which we know is a very significant issue. The Surgeon General came out with an advisory in May of 2023, really pointing to this issue across generations, not just for older adults, but for all people.
That's amazing. And then thank you for doing this and really identifying this sub-niche of loneliness. Now, as we know, we're at Vive. We love events, and you've been here before, and then you've been to many other events before. So why choose Vive, and what do you really want to get out of it?
Yeah, we're excited to be at Vive on a number of different levels. We're here with the support of the National Institute on Aging. We have been really blessed to have a small business Innovation Research Award, a non-dilutive funding from National Institute on Aging, and they invited us to participate here in Vive. So come on down to their pavilion and talk with us and the other great companies that NIA is working with. But I'm really here to connect with other companies that are also on a similar mission of transforming care, and also to talk with investors. We have not formally raised funds yet, and we are now doing so. So we're talking to investors here at Vive and exploring, raising some funds so we can take Determined Health to the next level.
We so appreciate everything that you're doing and excited that you're here with us.
Thank you.
How can people find out more about Determined Health or connect with you?
Yeah, so you can go to www.determinedhealth.com. You can come by our kiosk at the Vive Pavilion, or you're welcome to contact me on LinkedIn and by email. And I welcome the opportunity to talk to anyone that's really interested in this space. I know also you guys are the Caregiving Network, and I just want to also acknowledge our work with caregivers. Caregivers are at higher risk of loneliness and social isolation. It's a really significant job taking care of folks, whether it's a professional or a personal caregiver role. And we work with a lot of caregivers who need this connection, who might want peer-to-peer support, in particular people with that care for people with Alzheimer's disease or dementia. It's really challenging and often isolating. And our services have made a significant impact for this population as well.
Thank you so much for all the stuff that you have shared. Yeah, we're excited to see where you guys go from here.
Thank you.
All right. Did you feel you had an eye-opening moment from listening to Catherine, especially leveraging simple phone calls that some of us probably don't even take phone calls anymore because we are on video chats all day long, and how powerful it is to be able to reduce costs and how we build true trust and connection with our patients. Now, if you believe you have an amazing story to tell, you are a healthcare expert, advisor, or a leader in the space that have a solution in health tech or femtech that has made significant strides, then we would love to hear your success and share your solution. Go to theprovidersedge.com to apply as a speaker for our next episode. Next up, we have Kobe Takeda from PeerSuite. His solution is bridging a comprehensive way of leveraging volunteers, social workers, community health workers to bring an engaged community together while creating those strong social bonding movements as tapping into the mainstream of what we do as providing health, not just an afterthought of what the local community have to do for themselves. Now, we all understand social isolation is such a major issue, but even for some of us who has medical backgrounds like myself, that I'm going to need a procedure or medical advice, there's still a multiple hoop we have to jump through to get the right appointment, to get insurance company to bill for it. And then it's also very heartening to not know where to go when you have to make multiple phone calls. When you have a community, everything changes. So now let's listen to how Kobe presents his solution with PeerSuite.
Hi, this is Sabrina Runbeck with Caregiving Worldwide Network. I'm here with Kobe Takeda. And we're so excited to be interviewing founders in the space, truly creating some big movements in the healthcare space. So please tell us the story behind your company and what's the mission that you guys are hoping to drive forward.
Yeah, thanks so much. So I'm actually from the senior caregiving space. I used to work in senior living. I used to help with an assisted living facility. We had memory care, we had independent living. And I recognized the value of families and the connections that you create. Not just providing medical care and food and housing, but also the connections that you create. And that's really where PeerSuite started. We want to connect older adults with young people, young children, kids, people in college, students in high school. And we built this connection where they can call older adults during the pandemic and provide them social support. ask them how they're doing, check in with them, provide information, and it really blew up. We're learning a lot about older adults. They were learning about life and sharing experiences, and the older adults were learning from the kids. And it was just this wonderful intergenerational approach. We built on that. We knew we had to scale and wanted to grow and expand this, and we recognized the need for healthcare organizations to connect with older adults. So we started asking questions around healthcare. What are your life at home was like? What are you eating? Are you doing okay? Are you socially connected? Are you lonely? That's a huge problem right now, and we want to obviously address that. As we actually asked a bunch of questions, basically a health screening. We recognized there was needs that we had to address, and the students started providing solutions. They were talking about healthy food they could make. They were talking about solutions about getting to the YMCA nearby or being physically active, or encouraging them to go outside to walk the dog and be in the garden so they can cook healthy, fresh foods. So it's been really great to see the evolution of Pear Suite. Now the co-founder and CEO of Pear Suite, we're building essentially a software platform for volunteers, community health workers, caretakers, family advocates, anyone working with older adults, people that maybe need support, the Medicaid population, people with disabilities, people in public housing, LGBTQ, all these priority populations that oftentimes aren't being addressed, and a lot of them are caregivers for others. And I think the support that we can provide with community health workers, with promotoras, with advocates, is just what we need. We need to empower them and give them tools to be successful. So our platform now gives them those tools and information to be successful.
Yeah, it's such an exciting time because we think sometimes that generation has gaps in understanding, in perspective. Now we're actually, in your case, bringing them together to see the value of each other and where you're learning from both sides. And we know we have such a shortage in caregivers across the board. And most people are professionals working while they still care for the young or the senior or even family, friends that are just community that they belong to, and they wanted to make sure everyone is taken care of, safety, getting things. But we all have burdens, and therefore this isolation, as you're saying, is so crucial, both from the patient themselves, seniors feel isolated, and sometimes can be the caregivers feel isolated because they're having all this burden. And for you guys to be able to step in from a staffing perspective is a huge support and huge offload of that burden of the individual family members. So that seems an amazing movement that you burst into something that's now going to be scalable, building a platform. So how has been some bigger wins that come out of this whole initiative?
Yeah, thanks. We started off with these nonprofit organizations, organizations that maybe in your community, maybe tied to your church, maybe the senior center down the street, helping them get information about the people they're serving to better support them with the social determinants of health, right? Things like housing, food, transportation, things that maybe sometimes the healthcare system didn't recognize were important, but are so critical. Then we scaled and said, hey, this is obviously great. We're helping to solve these social needs, but who really cares about this? And it's actually the health system, right? Health systems are now recognizing the value of the social determinants of health and actually are paying for it. So now we're actually working more with health plans. We have our customers across 15 states now using our software, but also health plans contributing and paying for the software for these nonprofits to work with them and partner with them and close these care gaps, helping them address housing shortages, helping them connect people to resources like SNAP benefits, or helping them find local schools for education for their students and kids. It's been really great to see the healthcare system chip in, and that's allowing us to scale quite great.
Exactly. When we think about adaptation and compliance, it's because you have so many social issues that prevents people from actually getting to their health. And so all of the people, whether you are healthy people talking about self-care or the people who are already burning out and desperately need something, we all know we didn't take care of ourselves because the social side a barrier. And it can be as basic as where do you live? Where do you getting the meals that you need to because you're a senior, you couldn't get to the grocery store? Or some people lose their housing and be able to have the basic need of the individual. Then to say, how can we reduce the burden of the healthcare system so then we can provide a care on top from the medical, surgical treatment or the daily compliance. Just simply remember to take their med. Or the diabetic patient, you have to do some other self-care like knowing check for wounds, right? So you don't walking around with a wound that becomes a so septic infection. So having all these marriage of things together is such a great way to say, hey, let's offload the whole entire burden and start from community level, hospital system level, so they actually pay for this service and the people who truly need it can get to them when they don't have family members sometimes.
And it's really a revolution, right? We're seeing relationships matter a lot. We're also seeing that this is a way we can actually help the whole family, not just individuals, right? Previously it was like the patient is one person, that's all you're treating. Now you can actually impact the entire family when you help one individual get housing and food and helping them with transportation, right? Everyone benefits. And that's the same with caregiving, right? Anyone who is a caregiver or helping to care for a child or an aging parent, that impact of the home being healthier and happier for everyone really impacts the ones that really aren't oftentimes being addressed.
Yeah, perfect. So that being said, because you guys have different facets, how are you going to market with this platform to make sure the right people are actually using them?
Yeah, we started off with these nonprofits, like I mentioned, right? It was amazing that these small organizations that were using paper and spreadsheets and using notepads to take notes, like they're the ones really doing the job of the healthcare system, right? They're helping to solve these gaps. They're desperately looking for opportunities to work with health systems and health payers. With our software, they can. What's great is that we have so many organizations using this. The health plans are like, wow, this is great. We want to work with them, right? They don't know how to contract with or partner with nonprofits that are on paper and spreadsheets. So our solution allows them to do that. That's really how we're growing. We're finding organizations that care about the community, care about relationships, care about on-the-ground community health workers, promotoras, and other representatives, and seeing how do we make this connection work? How do we help with payment models? How do we help with contracting? And it's really bringing everyone together to make healthier, happier communities.
Exciting time ahead for sure with all the wins, all the movements that are going ahead. Now, also creating business is like a roller coaster. So sometimes we just wish we have a magic wand. So I'm gonna give you that magic wand so you can use on something big things. You can just get out of your way so you truly push this forward, to go to market, get as many people know. What would you use that magic wand on?
That's a really good question. There's such a big misperception and misconception around community health workers. These are people that maybe are doing this for 30 years but weren't considered part of the healthcare ecosystem. I think if healthcare executives can see the power and the beauty and the skills and the lived experience that community health workers bring, they'd really start to appreciate them more and actually incorporate them into the healthcare system and pay for them. And that's really what PearSuite's all about. How do we value the people on the ground doing the important work, help them get paid, help them grow their careers, help them get more training, help them get higher wages. That's really the goal of what we're doing. By seeing that, the wins with the organizations, the patients start winning, the families start winning, the doctors have less burden because they don't have to deal with people that aren't showing up for appointments, people that aren't taking their medications, because they are actually addressing all the social needs through these organizations. So if we can help more healthcare executives see the value of community health workers, I think we would win, the community health workers will win, the nonprofits they work for will win, and the families will win. That's really what we are looking for.
Yes, now it's about quickly adoption into giving people the right resources and help them grow from there. And we're at Vive. We all love summits and events. Sometimes can be a lot. Now, what brought you truly to Vive and what do you want to get out of it?
Yeah, I love being around this community. Being around people that are always thinking about new ideas, that inspire you. I look at leaders that here that are always thinking about new things to do and how to innovate in the healthcare system. This is a really broken system in some aspects, but it's also very innovative. There's people throwing money in here with investors. We're hearing what they're looking for. I love learning from other founders and other innovators, thinking about new ways to solve problems that have been here forever. I also love meeting with patients and people who are family caregivers. Everyone's a family caregiver to someone. And hearing their perspective and what they're looking for is really great. Providers, doctors are here. They're sharing their experiences. What are they trying to solve for? What are their challenges every day? And PearSuite really is trying to find how do we get a little bit of every perspective, make a great product, and actually increase adoption. And that's really our hope here. Be surrounded by people that are here, it really inspires us.
Yes, we all need more of those, right? We know our environment truly is a shape of how we perceive and how we carry ourselves and how we become even more open-minded to opportunities as we move forward. So how can people find out more about you guys and have a conversation or simply check you guys out?
Yeah, so our website is www.pairsuite.com, P-E-A-R, and we call it PearSuite because pairing is about pairing the generations. So we kind of played off the word pair. So PearSuite, SUITE.com. What's really great is we actually have a training program that we offer, free training for families, caregivers, community health workers, promotoras, to learn more about how to work with partnering healthcare systems and health plans. We offer that through our Payer Cares line of business, and it really helps organizations adopt what we're doing with community health workers and addressing the social health at scale. We're excited to meet with people out there and partner and support what they're doing. We work with organizations as big as large national health systems to small community-based organizations with 2 or 3 staff. And so we're really here for everyone.
Amazing. Thank you so much for all the stuff that you guys have been building for the nonprofit side, for really helping to reduce the staff issues that we have in caregiving space and truly supporting our end users and the people who are not having a lot of resources.
Yeah, thanks for having me, and thanks for sharing this information with everyone out there.
I'm just so fortunate to be the one who get to talk to these amazing founders and leaders in the healthcare space and be the forefront of conversation. And that's what we meant on this podcast, is having the right people to share their stories, share their knowledge, so we can all build together and understand this is also how you can create strategic partnership. From all the stories that you have heard, probably whether you loved Determined Health from Catherine's idea of what they can do with phone call to engage with patients versus Kobe's idea from Peer Suite of building that community to really leverage all the resources that we have from caregivers, from volunteers, from even young and old, bridging that generational gap, as well as leveraging the healthcare staff, therapists to be able to intertwine all different levels of care in the community. Now, those will be the chance that you reach out to these individual speakers or anybody that you have met to have these conversations, to mention that you have heard about these ideas on Provider's Edge, and then what you thought about them, what intrigued you about these solutions, and what you can build on top of them. And perhaps reaching out directly to these impact creators to collaborate. And that's what we meant to do and how we truly can grow from within and with our community and what we call the empowered ecosystem. And you have to have the foundation and continue to spread your amazing messages. Now, what do you truly loved about today's episode? I think we have talked and shared many episodes. This show has been going on for more than 200 episodes. In this second season, after our first 100 episode launch, we relaunched to focus really on the innovative solutions and how as leader to be able to lead this innovation from both within as a leader ourselves, to be resilient, to be able to recognize solutions and opportunities, as well as a big organization as a whole. And now we're also tapping into these technology solutions to help us. So I'm curious, do you guys see how you can leverage technology to further improve patient outcome in some way? Were you already doing it? Share with us by commenting below wherever you're watching this or listening to this podcast, or take a screenshot or making a comment on LinkedIn and tag me, Sabrina Runbeck. Love to engage with you on a conversation on how you're really moving the needles for how we either take care our own self as clinicians, as therapists, as the whole entire community of supporters in health and wellness space, as well as these tech innovators out there. What have you created that truly needed to be recognized? And how are you adapting technology, either it's tech itself or tech-enabled solutions? And for everybody else that are still in that brick-and-mortar traditional practices, what are the ideas that you had to make your life easier? Perhaps it's just simply a HIPAA compliant CRM system that you are continue to grow and build that relationship with your patients, provide educations when they're not in front of you. or perhaps it's something that actually is a knowledge and tool, just like the two speakers that we have, that you are able to give back to the community. Let us know, what have you been thinking of leveraging technology? What technology you're already using? Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.